Ever catch yourself spacing out? Like you're staring right through something and someone's like, hello, Earth to you.
Happens to the best of us.
Right. It's like our eyes are always making these tiny adjustments without us even knowing until something's not quite right.
And that's when we start to pay attention.
Exactly. Which leads us to today's deep dive. You've asked us to look into exotropia, which turns out is way more common than you might think.
It is. Exotropia is basically when one eye has a tendency to drift outwards. It's a form of strabismus, the medical term for eye misalignment. And it's surprisingly common. A full 25% of childhood eye misalignments are due to exotropia.
25% is a lot of kids. And you say the eye turns outward, so that's different from when eyes cross.
Exactly. That inward turning is called esotropia. Both are types of strabismus, but they have distinct characteristics. And what's key is that early detection makes a real difference in getting the right treatment.
Okay, so it's not just a case of eyes aren't straight. There's more to it. You mentioned different types of exotropia. Is that where it gets really interesting?
Absolutely. Exotropia isn't a one-size-fits-all condition. We can break it down into four main types: sensory, intermittent, congenital, and alternating.
Four distinct types. Okay, so how do we tell these apart?
Let's start with sensory exotropia. This usually pops up in older kids, around ages 2 to 4. Essentially, if a child has an eye with poor vision or blindness, it can lead to that eye drifting outwards.
So that's like the body saying, well, this eye isn't working as well, might as well relax it.
In a way, yes. Now, intermittent exotropia is the sometimes kind. You might notice it when someone is tired, daydreaming, or looking at something far away. Think of kids zoning out on a long car ride. That's a classic scenario.
So one is related to actual vision problems, and the other is more about how the eye muscles are coordinating. What about the other two?
Congenital exotropia, as the name suggests, is present at birth. This one's especially important to catch early on because it might be linked to other medical conditions and needs a specialist's attention right away.
Makes sense. You want to get ahead of it if there are other things going on. And the last one.
Finally, we have alternating exotropia, which happens to be the most common type. In this case, the outward turn switches between the eyes.
That's interesting that it switches. Is there a reason it's the most common form?
It's not entirely clear why, but it seems our bodies like to keep things somewhat balanced, even in the case of something like exotropia. Our eyes are in constant communication, aiming for that perfect teamwork to create a clear picture.
Okay, so we've got different ways this can show up. But what actually causes exotropia in the first place? Is it something people do, like staring at screens too much, or is it more complicated?
It's definitely more complex than just screen time. While there's no single cause, it comes down to how well the eyes work together to focus. It's all about teamwork eye muscle. Teamwork, that is. The muscles that control eye movement need to be in sync, but with exotropia, that coordination is off.
Like a team where someone's always pulling in a different direction, and you can't quite get that unified effort.
Precisely. And there are a few things that can throw off this coordination. Genetics, for example, play a big role. Family history is a major risk factor. If a parent or a close relative has it, a child is more likely to develop it as well.
So if it runs in the family, that's something to be extra aware of. What else besides that family connection?
Well, it's not just straightforward inheritance. There are certain conditions, like Duane's syndrome.
Duane syndrome, that sounds like a whole other thing.
It is. It's a condition present at birth that affects eye movement, and one of the ways it can manifest is through exotropia. In essence, the nerves that send signals to the eye muscles don't develop typically, which can lead to difficulty moving the eyes inward.
So faulty wiring, basically.
You could say that. And then there's the medial rectus muscle. This muscle is crucial for controlling inward eye movement. And if it's weakened or damaged, say, after surgery or due to other conditions, it can also lead to exotropia.
Wow, okay, so it's a whole range of things. From your genes to specific conditions, even complications from other procedures.
It highlights how interconnected everything is within our eyes. And it's not just those things. Certain risk factors can increase the likelihood of developing exotropia, things like childhood cataracts, glaucoma, and even Down syndrome.
So eye health is really important across the board. But let's say someone's listening thinking, wait, maybe I have this or my kid does. What are the telltale signs? What should we be looking for?
You're right to ask, because those signs aren't always obvious. Of course, the most noticeable one is the eye turning outward, which, as we've said, might only happen some of the time, especially early on.
Especially with that intermittent type.
Exactly. But then there are the subtler things, like do they complain about their eyes feeling strained or tired? Are they sensitive to light? Headaches, especially after reading or focusing for a while, are another thing to watch for.
Those are all things people could easily brush off, though.
They are, unfortunately. And kids, especially younger ones, might not even think to mention them or might not be able to articulate what's going on. So look for things like difficulty reading or even tilting their head to see better.
So if you're noticing a pattern, that's a sign to maybe dig a little deeper.
Exactly. And this is important. We are not doctors here. Don't rely on self-diagnosis. If you see any of these signs in yourself, your child, anyone, the best thing is to talk to an eye care professional. They can do a proper assessment and figure out what's really going on.
Absolutely. Better safe than sorry every time.
Yeah.
But what happens if it does turn out to be exotropia and it's left untreated? Are we talking cosmetic issues here, or can it actually cause bigger problems?
It's definitely not just cosmetic. I mean, the outward turning of the eye is what you see, but it's the potential impact on their actual vision and eye health that's the bigger concern.
So it's not just how it looks, it's how it affects them day to day.
Precisely. One of the biggest things that can be affected is 3D vision. Think about how our brains use the slightly different images each eye sends to figure out depth and distance.
Like when you're trying to catch a ball or parallel park.
Exactly. Exotropia can mess with that coordination, making those everyday tasks a lot harder. And it goes beyond just depth perception, too. We see a lot of people with headaches from eye strain, having trouble reading because words blur or double. And here's a stat that always surprises people. Over 90% of kids with intermittent exotropia develop myopia, that's nearsightedness, by the time they're 20.
90%. So this thing that might seem like a small issue can snowball into a whole other vision problem down the road.
That's where we're diving deep into this. The more you know, the better equipped you are to recognize the signs and get help early.
And speaking of help, let's talk treatment. What can actually be done about exotropia? Is it a one-size-fits-all kind of thing?
It's definitely individualized. The good news is we've got options, both surgical and non-surgical. And the best approach depends on a few things. The type of exotropia, how severe it is, the person's age, their overall health.
Okay, so walk us through it. Let's start with the non-surgical stuff. What are we talking about there?
One of the most common, especially for kids, is eye patching. Sounds simple, but it's surprisingly effective.
So you cover the stronger eye to force the weaker one to pull its weight.
You got it. It helps strengthen those eye muscles and teaches them to work together better. Then we've got special glasses with prisms in the lenses. These can help redirect the light in a way that makes the images each eye is sending line up better for the brain.
Like those glasses with the really thick lenses you see in old photos.
Exactly. Though, thankfully, the technology has come a long way since then. And for some people, vision therapy is a great option. It's basically a customized program of eye exercises to help retrain the eyes to work together.
So kind of like physical therapy, but for your eyes. What kind of exercises are we talking about?
It can vary, but it often involves things like special lenses, computer programs, or even just focusing on moving targets. For example, one exercise might involve having the person follow a target with their eyes as it moves closer and farther away, helping to improve their focusing ability and eye teaming.
It's amazing how adaptable our eyes and brains can be. But what about those cases where those non-surgical options aren't enough? When do you have to go the surgery route?
Surgery is usually something we think about if the other options haven't given us the results we need, or for more complicated cases. The goal is to adjust the eye muscles themselves, either their length or positioning, to get those eyes back in alignment and hopefully give them back that binocular vision.
So it's like fine-tuning the mechanics of the eye.
Exactly. Now, it's important to remember that surgery isn't a guaranteed fix. How well it works depends on things like the specific condition, how early we caught it, that kind of thing. But a lot of the time, it makes a huge difference in their alignment and how clearly they can see.
That's good to hear. Now, this is a question I bet a lot of parents especially are wondering, can you just outgrow exotropia? Like, is it something that might just go away on its own, especially in babies?
It would be great if it just magically fixed itself.
Fingers crossed.
Right. And in some rare cases, it does happen, especially with babies. If it's mild, sometimes it resolves on its own in those first few months of life. But, and this is a big but, it's really important not to just bank on that happening. More often than not, some kind of treatment, patching, glasses, vision therapy, something is going to be needed to help manage it.
So a glimmer of hope for those spontaneous fixes, but always better to be safe and get it checked out.
Absolutely. Early detection and getting them the right treatment is key.
This has been fascinating, honestly. We've gone through the different types of exotropia, what can cause it, those warning signs to look out for, even all the ways it can be treated, which, as you said, is very individualized. It's amazing how much goes into something we usually just take for granted.
You're right. It's easy to forget how complex our vision system really is until something like this disrupts it. And even though we've covered a lot of ground here, this is just scratching the surface. There's always more to learn, more research being done.
So there's hope for even more effective treatments down the road.
Absolutely. The field of ophthalmology is constantly evolving. New technologies, new techniques, they're popping up all the time. What seems like a challenge today could have a much simpler, more effective solution in the future.
That's got to be reassuring for anyone listening who's dealing with exotropia themselves or with a loved one. It really highlights how important knowledge and early intervention are. We've covered a lot. Different types of exotropia, causes, warning signs, treatment options, and the importance of getting an eye care professional involved early on. If anything we've talked about today has resonated with you, if you recognize the signs in yourself or someone you know, don't wait. Reach out to an eye doctor. Get that personalized assessment.
Couldn't agree more.
Yeah.
And here's one last thought to leave you with. Our eyes are amazing. They're incredibly intricate, capable of things most of us don't even realize. By taking the time to understand them better, even something as complex as exotropia, we're taking a huge step in being able to care for our vision. And that lets us experience the world with more clarity and confidence.
Beautifully put. A perfect place to wrap up. To everyone listening, thank you for diving deep with us on this. We'll catch you on the next episode.